say that we have some common interests, although we come from different contexts. For example, we all want the safest and most competent care for ourselves and our loved ones in the hospital setting. Baby Friendly falls short of the promise that the hospital makes to perform the safest and most competent care. Let me give you a case in which Baby Friendly falls short of their promise. After giving birth by cesarean section, a major abdominal surgery, Christine Coogan felt like she wasn't the ideal person to care for her infant the first night. But to her surprise, Coogan said, the nurses declined to take the newborn to the nursery so she could rest and recover. Instead, her newborn roomed in. There are barriers within the Baby Friendly Hospital Initiative that prevent the program from being the most ideal practice for mother-baby care. These are barriers that fall under 2 of the 10 baby-friendly steps in the U.S., rooming in and breastfeeding. Some of the barriers are, but not limited to, cesarean section, tiredness and exhaustion, pain medications given to new mothers after giving birth, incompetence of the new mothers, and core convictions such as culture. The cesarean section, as explained before, is no joke. It is a significant barrier to rooming in. After this surgery, the mother is expected to care for her newborn the entire duration of her stay at the hospital. This can lead to serious problems. For instance, the mother could risk damage to the incision site by performing too many tasks for caring for her baby. The baby could be neglected because of the mother's incapability to successfully care for him or her. Also, the new mother could be under the influence of pain medications from the trials of childbirth, leaving her the least ideal candidate caring for her newborn. The baby's safety is at risk at this point. The mother is not knowing of the signs that newborns have. The nursing staff and the doctors in the newborn nursery do. They can spot these signs with watchful and alert eyes, and this would be in a controlled environment. This is a realistic barrier that needs to be resolved. Although breastfeeding has been documented as the best form of baby feeding, there are existing barriers that leave mothers incapable to breastfeed. Now, some of these common barriers deal with milk production and milk letdown. Full or young gives other obstacles. If the mother has some type of medication that's given to her, a breast infection or abscess, breast cancer or other cancers, previous surgery or radiation treatment. The CDC adds to the list of barriers in breastfeeding. Practices such as delayed timing of first breastfeeding, the use of labor analgesics, epidural anesthesia, and surgical cesarean birth have all been demonstrated to negatively impact breastfeeding. Tiredness and exhaustion reflect the mother's physical and emotional well-being. Childbirth is a strenuous event on the mother as well as the baby. Rice explained, rooming in may be the most ideal practice for women who want to be in control of their infants during their stay at the hospital. However, for women who believe that rest is important during the postpartum period in order to regain their strength and health, regardless of sociocultural backgrounds, rooming in may not be appropriate. Rice also explains a case in which a new mother witnessed hospital practices that conflicted with her cultural beliefs. This woman was left with feelings of not wanting to have anything to do with her caregivers during the hospital stay, and the intention not returning to the hospital for her next birth. This woman lost all respect for the hospital she chose to have her baby due to cultural incompetence. A solution to this problem would be to incorporate birth plans. They would be individualized to each mother. These birth plans will help prevent stress on the mother. The most appropriate care will be given through the hospital personnel's cultural competence. The newborn nursery is essential in mother-baby care. Decatur Morgan Hospital has both rooming-in method as well as the newborn nursery. They state, should your baby room in with you or stay in the nursery? Whichever you decide, both of our choices will ensure that you and your baby are surrounded in the utmost comfort and care. Birth plans should be mandatory, while rooming in should be left an option along with the newborn nursery. This will allow the mother to rest physically and emotionally. The safest and most competent care will be provided through the nursing staff caring for the newborns with watchful, alert, and competent eyes. There will be less stress and frustration on the mothers, and in turn, a better hospital stay for the new mothers as well as the newborns. Thank you.